Hi, I'm Andrea Watkinson, Executive Director of Cancer Services for Unity Point Health, St. Luke's Hospital, and the Nassif Community Cancer Center in Cedar Rapids, Iowa. As a leader in cancer screening and treatment in Iowa, we're proud to sponsor the Iowa Ideas In-Depth Week Cancer in Iowa series. As Iowa continues to see some of the highest cancer rates in the nation, it's more critical than ever to address the issues causing this trend and to educate our communities on the resources available in our state. This series will take an in-depth look at everything from cancer rates and causation to research and long-term impact cancer has on the state of Iowa. We'll also discuss advancements in treatment and how crucial it is to complete your cancer screenings regularly and on time. We hope you find these sessions informative and find valuable takeaways. Our overall goal at Unity Point Health, St. Luke's, and the Nassif Community Cancer Center is to reduce cancer rates and work towards a healthier state for all Iowans. Enjoy the event.
Hello, everyone, and welcome to Iowa Ideas In-Depth Week. This year is our 9th year of Iowa Ideas, an event that explores topics that are consequential to Iowans. We're excited for an important week of discussions about cancer in Iowa. The Gazette would like to give a special thank you to our presenting sponsor, ITC Midwest, and our In-Depth Week sponsor, Unity Point Health, Cedar Rapids. Their support helps make the Iowa Ideas discussions free for everyone to watch and participate in. You'll be able to submit questions to our panel today by entering them into the Q&A box or in the Zoom chat, and we will try to work them into the conversation. Today, we will be discussing the causes of cancer and how they might be identified and potentially prevented in Iowa. The state has the second highest and fastest growing rate of new cancers in the United States, according to this year's Cancer in Iowa report. It is one of only 2 states with a rising rate of new cancers. More than 20,000 people are newly diagnosed with cancer each year in Iowa. I'm Jared Strong, an investigative reporter at the Gazette, and today I am joined by an esteemed group of panelists. We have Mikayla Pittman of the American Lung Association, Danielle Pettit-Majewski, the Johnson County Public Health Director in Iowa City, and Sarah Green, Executive Director of the Iowa Environmental Council, the state's preeminent advocacy group for the environment. I'll let each of them give you a little bit more of their background. Sarah, if you want to start.
Sure. Thanks for having me here today. The Gazette has been a great partner with the Iowa Environmental Council, and we look forward to that partnership continuing. I'm the Executive Director for IEC. I'm based out of Des Moines, and IEC is the state's oldest and largest environmental coalition. We've got 3 programs, which is clean air, clean water, renewable energy, and then climate initiatives. So that's environmental justice and health equity. So this topic weaves into all of our 3 program areas. We do our work through a 3-pronged approach through education, through outreach, and advocacy. And we've got a small but mighty team that's statewide. We've got 14 staff members.
Very good. Danielle, would you like to go next?
Yeah, thank you so much. And thank you so much for having us here today to talk about this. Danielle Pettit-Majewski, Director here at Johnson County Public Health. We have a large variety of programs that we do here in Johnson County to serve our community and also surrounding communities. And one of the reasons why I'm so excited to be here to talk about this is because, cancer is a public health issue that has a number of policy and personal impacts. So we really want to talk about how we can improve our cancer rates through policy decisions at the state and local level, and also what we can do as individuals to help prevent and catch cancer early. So very excited to be a part of this conversation.
Mikayla.
Last but not least, hi everyone. Thank you so much for inviting the American Lung Association to speak on this panel this afternoon. I am Mikayla Pittman. I am with the American Lung Association. I am the manager of nationwide lung cancer screening with our patient engagement team. We, as a lung association, have been around for over 120 years, really working to protect Americans and their lungs. through researching treatment, cures for lung diseases, keeping kids off tobacco, including e-cigarettes, advocating for laws that protect the air we breathe. And similarly to Sarah, we do this with a three-prong approach through advocacy, education, and research to address public health issues. We're really working to defeat lung cancer, champion clean air for all, improve the quality of life for those living with lung disease and their families, and creating a tobacco-free future. So definitely very excited to be here to speak on this. So thank you.
All right, yeah, thanks everybody. And we're going to dig in. We're going to talk about some of the most well-established causes of cancer, some of the efforts to detect it early or even prevent it, and then upcoming research that might uncover carcinogens in agriculture. Mikayla was the last for the intro, but the first one who gets the questions. So you told me we have two main causes of lung cancer that are common to every state. And this is, I think, kind of universal across the country, right? Yeah. What are those?
Yeah, so there are a few. So the two main causes of lung cancer, two risk factors, is smoking. So it is the number one cause of lung cancer, most preventable cause of lung cancer, causing about 90% of all lung cancer cases across the board. We also have radon exposure. So that is the second leading cause of lung cancer. And I know we're probably going to go into this a little bit more in depth a little later, but 1 out of every 15 homes are subject to radon exposure. So definitely something that can cause cellular damage to the lungs, which can then lead to lung cancer. We also have hazardous chemicals. So working with materials like asbestos, uranium, nickel, some petroleum products are also especially dangerous. Particle pollution, again, we'll be going into this more in depth later, but this is a mix of very tiny solid liquid particles that is just in the air that we breathe. So this could be exhaust smoke, it could be acids, organic chemicals, metals, soil, dust, very, very tiny fraction of the size of human hair, and things that get stuck in your lungs. And then a history of cancer of any kind also increases your chances of developing lung cancer later in life. But really looking at smoking and radon being the top two causes of lung cancer, radon for those who do not smoke, but then kind of looking at all of these, if you are exposed to more than one, it does increase your chances of developing lung cancer later in life as well. We're also looking at secondhand smoke, third-hand smoke, the lingering effects of that smoke on objects, on toys, pets, things that you're actively touching in your home. I mean, smoke sticks to walls, right? So in that, when we clean the walls, that never looks good. So we're definitely looking at smoking and radon being the two number one risk factors for lung cancer.
And third-hand smoke, maybe I'm ignorant, but I had never heard that term before. Is that what you're talking about, this incidental contact from places where smoke gathers that you kick up later?
Exactly. So secondhand smoke would be, you are around somebody who is smoking, you're actively breathing in that smoke, where third-hand smoke is just the residue that has since piled up on walls, on toys, and is actively being breathed in even when you don't think about it. So third-hand smoke exists, but yeah, to your point, it isn't as talked about.
Yeah. So like what either I said or you said before, these causes are pretty universal across the country. How is Iowa different in any way of these things affecting us? I think smoking is maybe more common in rural areas. Is that how does Iowa compare to other states as far as smoking and radon goes?
That's very accurate. Most, those who are in rural areas, construction workers, those below the poverty line, those who are uninsured, those individuals, those groups of people tend to have higher rates of tobacco use. In Iowa in particular, so excuse me, I'll be looking off to the side a couple of times here to look at some of my data, but the smoking rate in Iowa, according to the American Lung Association's State of Tobacco Control, 14.7% of adults are currently smoking cigarettes, and that is compared to about 11.6% nationwide. So it is a higher percentage of individuals who are currently smoking, and population in Lynn County, Scott, Johnson, Blackhawk, Woodbury, Story, Dallas, though some of those counties are going to be the ones with the highest amount of individuals who are currently smoking. In terms of radon, the entire state of radon is in zone 1, which really indicates that Iowans have a very high potential for elevated levels of radon exposure and gas. So we're looking at about 71.6% of all homes in Iowa having higher than average levels of radon compared to the overall U.S. average of 1.3. The average in Iowa is 8.5. So we are looking at very much increased levels of radon. In the Midwestern states in particular, radon is going to be higher than some of the southern states, as is smoking rates, because it is kind of a bit more of quote unquote tobacco nation in the Midwestern and southern states, where tobacco companies, big tobacco companies, would have really targeted their outreach. And we don't see as much coming through when it comes to tobacco control. So we do see those rates being higher than average. For lung cancer in particular, we do see that, and this is through the Lung Association's State of Lung Cancer report, that Iowa ranks 39 out of 49 for new lung cancer cases out of all of the states. So we're definitely seeing higher rates for lung cancer cases. We're also seeing higher death rates. We're seeing really the makeup of lung cancer cases being a lot higher in Iowa compared to other states. In Iowa, lung cancer makes up about 23.4% of all cancer deaths, and that's in 2024. Lung cancer is the leading cause of all cancer deaths. It's surpassing prostate and breast cancer combined, and that's always a surprise when people hear that, but it's true. So we are seeing higher incidence rates across the board.
And when you said 39th out of 49, is that on the bad end of the spectrum or on the good end of the spectrum?
It is unfortunately below average compared to other states. Yeah.
And how has our smoking rates changed over time? I assume it's improving, but is that the case?
Yeah, smoking rates across the board have fallen pretty substantially across adults since really 1965. There's been a lot more in tobacco control that's been happening. We have tobacco settlement dollars coming through. We see more bills being passed to do more effective tobacco control across the board. So tobacco rates have fallen. We have seen a decrease in males and females smoking and using tobacco. But it is still very prevalent. We're actually seeing a rise in individuals using e-cigarettes and vaping, which is definitely, it's not healthier than smoking cigarettes. There's a lot more combustible in there, other chemicals that are included, even though it doesn't look like it. There are a lot more chemicals in there. So we're seeing some changes across the board, and in Iowa in particular, but yeah, that is what we're seeing in terms of smoking rates.
So are you saying that vaping or e-cigarettes is actually there's a higher cancer risk going that route?
Well, there isn't enough evidence really to say to confirm any long-term effects to exposure to using vapes or e-cigarettes. We're a little too soon with research there. I will say that people, in particularly kids, are starting to use e-cigarettes and vapes a lot earlier than they did even 5 years ago, even last year, and a lot younger as well. So that is a new area that we as an organization are doing a lot in with tobacco cessation for teens and kids in particular, trying to kind of do more group cessation courses in those populations. So yeah, unfortunately, I couldn't tell you yes or no, but the research is still out there. So
yeah, well, yeah, and so you talked about these cessation programs. What I assume that's a big part of your efforts to combat the problem. What else? What else can we do?
Yeah, so there are quite a few cessation programs that the Lung Association, but also Iowa has. So Quitline Iowa, the state quitline for tobacco cessation is incredibly useful, beneficial, very powerful in getting people to quit smoking and using tobacco products. So, you know, if you know somebody, if you do smoke, that is a great avenue. We also have internally with the Lung Association, we have Freedom from Smoking. That's our group courses. Those are, they can be in person, they can be online, and they can be self-guided through different workbooks. And we also have a Freedom from Smoking facilitator course. So that is something, if there is an interest, whether it's for, you know, just anyone who is interested in supporting somebody trying to go through their quit journey, they can learn how to host their own cessation courses using our evidence-based facilitator training. So that is something that can absolutely be done. There is a lot happening on the policy side as well, both federally and statewide. So there is a huge risk to Medicaid access that's currently happening. And so this week in particular, the Lung Association is really calling on people to contact their legislators and take action. 1 out of 4 Iowans are covered by Medicaid, and Medicaid currently covers screening for lung cancer, a lot of other really important resources to prevent these different cancers, including lung cancer. So we definitely would encourage people to go to ourlung.org /action to kind of join the Lung Action Network, find out what's happening locally as well as nationally on the policy level, and, you know, be able to contact their legislators in that space. That is, contacting legislators has a lot more power than you think. So their phones are always incredibly busy, and they keep a note of everything that their constituents are calling about. So that is the single most important thing that can be done in terms of protecting access, prevention, and ensuring that everyone has equal access and support in all of these different preventative measures and lung cancer screening and treatment for lung cancer as well.
So on radon, and we're going to shift to Danielle at this point. In her county, and I assume most counties or all counties in Iowa help facilitate some radon testing of homes. If I'm a Johnson County resident and I want to get a radon test, how do I do it? What do I do?
Yeah, absolutely. I mean, well, you could go to a hardware store, or you can also pop in and talk to us here at the health department. We sell them at cost. They're about $12. They're really easy to use. You just stick them in your basement for a couple of days, and you will be able to get a test result. Obviously, we don't do anything in regards to mitigation, but we do think it's really important for folks to test for radon to know if it's in their home. Because as Mikayla said, all of Iowa is in like the highest risk, for radon gas. And so we really do need to be cognizant about what our exposure is. And so we want to make it as easy and cost effective as possible for our Johnson County residents to have access to those tests. And that's really something that you should be able to get at any local health department or any environmental health department, or like I said, your local hardware store. They're usually pretty inexpensive.
Yeah, and I mean, it's as we've discussed already just a few minutes ago, this issue of radon is huge in Iowa and the Midwest. Do you feel like people are generally aware of the problem now, or is there some more education you think that needs to happen about it?
Well, we continually provide education about radon. There's Radon Awareness Week. We as a health department are always trying to put out information about that when it becomes apparent, when that week comes around. But also, I do think, if I'm not mistaken, I think Mikayla or Sarah, you can also confirm with me, but when you're selling a house, you need to make sure that you've tested for radon and you've implemented a radon mitigation system before that sale can go through. So I do think that there's more acknowledgement about it. I know I had this conversation with my own parents, just recently as they were getting their home tested for radon. Because if you've been in your home for a long time, or if you've had a family home and you haven't had it tested because it hasn't been for sale, it's really good to really raise awareness around that, because it does put you at increased risk for cancer.
And you guys also help facilitate some testing for PFAS, which are chemicals that people might know it that way. It's sort of a new contaminant that people might not be familiar with. What is it? What is it?
Yeah, absolutely. Okay, so I'm going to butcher this. And like Mikayla, apologize for, I'm going to look so I can say this. Okay. Per and polyfluoral alkyl substances. So, or PFAS, or forever chemicals. Thank you. My chemistry lessons are coming back to me. But this is a man-made chemical, and it's in so many different things. It's in our drinking water, our soil, our food, consumer products. So like if you ever wear like anything Gore-Tex, or you have a nonstick pan, there's going to be PFAS in those materials. And so one of the things that we provide now, and this is fairly new, is PFAS testing through our private well grant. We get every county in Iowa gets dollars every year from the state for private well grant funding so that we can do water testing. And one of the reasons we were just able to, we used to be able to do PFAS only as like a special scenario because we had a small community that was impacted by some of the runoff from the Cedar Rapids Community Airport. And that was impacting some local water supply in the northern part of Johnson County. PFAS testing is expensive, but as we've talked about, it is in everything. And so it's a forever chemical. Its half-life is about 20 years. And so as we see that buildup in our bodies, it can increase our risk for cancer. So we are able to provide grant funds so that folks can get their wells tested to see if they have PFAS in their water, and then be able to talk to somebody about getting a system that can help reduce that exposure in their drinking water. But again, it's in so many things. And so raising awareness about the risk, because again, it's only a couple years ago where this word started to be common in our dialect here at the health department. So there's a lot of new information about it. And I know we had a presentation about this a couple of weeks ago at the State Hygienic Lab, but they are continuing to learn more about how to test differently. It'll be interesting to see if we're able to test tissue, because it can also impact pregnant people, and also children at birth. So really important to be aware of, really important to test for. Kind of expensive, so that's why I'm glad that we have some funding from the state to help our rural residents especially get that water tested.
Yeah, well, and for our viewers who are not aware, the EPA implemented some pretty strict limits for drinking water that's set to go into effect in the coming years of 4 parts per trillion for a couple of the variations, which it's almost nothing. The federal government is basically saying that no amount is safe at that point, right?
There is no safe amount, and 4 parts per trillion is the absolute max allowable. And for a visualization, that's like 4 drops in 20 Olympic-sized swimming pools.
And as far as eligibility for the testing through the county, are there some restrictions on, like, you have to be so far from where there was a positive test or so far from an airport, or is it open to everybody?
It's open to everybody. If you have a private well on your property, you can call your health department and schedule a test. They may be out of funds, so then call in July again, because that's when we get our new funding.
Gotcha. And switching gears just a little bit, you also help with vaccinations for HPV, and this is the only
Cancer
vaccine that you can use to prevent cancer. Is that right?
Yeah, absolutely. Yep.
And what, how popular is that vaccine? How has that changed over the years? And, what do you do to try to get the word out about its availability in your
Yeah. Well, we've really, over the last 20 years, I think we've really seen an evolution around the HPV vaccine. I believe, in graduate school, maybe undergrad, when it came out. So it's been a little over 20 years since we've seen it introduced onto the market. And it was really targeted towards young women as a cervical cancer prevention vaccine. And, just the knowledge that we have had over the course of time, even my time in practice, I remember, being excited when insurance would cover adolescent boys getting it. Because, this cancer forms from human papillomavirus, which, it can cause cervical cancer, but it can also cause anal cancer. It can cause throat cancers. It can cause mouth cancers. And as we have seen, and we continue to do studies, they have actually backed up the age so that the best time to get it is at age 9 for it to be most effective for the lifespan. And if you get it at a certain age, you only have to do 2 doses. If you get it after a certain point, you have to have 3 doses. So it is better to get it early if you can. It's not required for school, and so though we don't always have the same uptake. And in fact, as you look at the data from IRIS, which is the state immunization registry, it is far below what we see for other adolescent vaccines.
And why is that? There's somewhat of a stigma with it, right? Because it's an STD, basically.
Yeah, I mean, I think there is some. Let's call it the ick factor, maybe. It's like, I don't want to be thinking about giving my 9-year-old a vaccine for a potential, cancer that she could get from having sex. He or she could get from having sex, and I always counter it, like, my infant got Hep B before we left the hospital at discharge. There are vaccines that we give at certain periods of time because it's most effective for our bodies to build an immune response to get them at that age. It doesn't have anything to do with whether or not they're going to have sex to pass along that virus. But it does spark some concern. And it does, like I say, kind of sometimes have that ick factor if parents aren't really thinking about how they want to have that conversation with their children yet. I will tell you, my daughter does not know what she's getting poked with when we go to the doctor. So getting all those vaccines that are recommended. But it's just such a gift that we have a vaccine that will prevent cancer. So we really try to talk about it that way. And one of the things that we have done that has been effective is we have visuals in our office of, like, this is what it looks like. This is what HPV looks like on your vulva, on your penis, what it could look like as a mouth cancer. And that has typically been pretty helpful in helping parents say, actually, let's do it. Because it isn't required for school, but it's just a really good protective vaccine. Also, not only to mention, protecting cancer, but also to help prevent any reproductive issues down the road as well.
Mm-hmm. And what are other barriers that you're encountered in recent years? Going through the COVID pandemic has brought out what looks like sort of an anti-vax wave. We've got, at least one child's died of measles down in Texas. How does that play into it?
Yeah, 2 children actually have died from measles now. 3 people total. I think, as I said to you yesterday, a lie gets around the world before the truth gets out of bed. And there has been a lot of misinformation and disinformation spread about vaccines and vaccine safety. And that makes it sometimes difficult, because we really want to be that trusted messenger. But when there is a lot of other conflicting information out there, it can sometimes make it difficult. And I will say too, in Iowa, we are not acting in terms of policy as we are, second in the nation for cancer rates. We are making it no longer required to talk about HPV and sex ed in schools. It's allowed, but it's not required. We're making it easier to get an immunization exemption form than to get an immunization. It's not fun to take your kids for immunizations. Any parent will attest. They don't like them. They will scream, they will cry, especially if they're very small. But we have made it easier to not get them than to get them. When really, obviously measles and how that is spread, and that could be a whole other conversation we could have, is different than how you're going to look at HPV. But as we think about it, success in public health is nothing happening. Success in public health is your child not getting cervical cancer. Success in public health is your child not getting the measles. And we don't measure very often things not happening. It's very unsexy, the results of our work, when things are just working well and you don't have to think about it. But we are in a position where we really need to be having those conversations and bringing this up to the forefront.
Before we get too much farther in, we've got a couple notes and questions from some of our attendees. One person noted that they did not find that a one-time test for radon was great for, I guess, maybe knowing the entire issue. I think those levels can change over time. I know when I tested my house, you're supposed to do it a certain amount of time apart just to make sure that there wasn't that fluctuation. This person noted that there are continuous monitors that you can get. So it's maybe $150 that just continuously checks for radon. What do you recommend? Do you get those sort of instantaneous tests every so often, or do you spring for the continuous monitoring?
I would say yes and yes. I think if you're looking for, an answer to be like, okay, do I need to move further? A $12 test is a good way to go. If it's high, check it. If you want to get a couple and check them separately, absolutely do that. If you are seeing that you do have high levels, yeah, get a more robust testing system that's going to keep track of it. But I think as a way to start, $12 is a pretty low barrier. Obviously, as you're looking at mitigation systems, those can get a lot more expensive, but this will at least get you started. And really starting to realize, what is your risk? Because as Mikayla was talking about, all of Iowa is in that high radon zone. But that doesn't say like, oh, okay, you should just assume like you should still be getting tested. So yes, start that low barrier $12 test. And then if you are having issues, please continue to either get that remedied or continue to test for your own safety. And
we had a question about mitigation systems. I don't know if anyone can speak to this, but what are those typically? If I say I have radon in my house, how much is it going to cost me to install something, and how easy is it to do? Anybody?
I don't have any expertise on that, so I'm looking to my co-host. Yeah.
Radon test kits really vary across the board. Some states have programs that the state itself will provide free test kits through like a hotline or different programs or grants. You usually can find them at like a Home Depot or an appliance store. But I will say if there's any like specific questions on radon, on mitigation, on test kits, the Lung Association actually contracts with Iowa Health and Human Services to run the Iowa Radon Hotline. So if there are any questions, they can also support in really trying to see what might be best for you as you're testing for the levels in your home.
But to answer the question, I don't know what a price point is. I was just doing some Googling because it's like, I don't know. It looks like you can schedule estimates with different companies to give you a better idea of what that would cost. Because like I said, if you're going to sell your home and you have high levels of radon, you'll have to put in a mitigation system.
I think for mitigation systems, I know with schools, they can be incredibly expensive. And I know Iowa just passed, I think effective earlier this year, the School Radon Safety Act, which lowered the cost for putting in a mitigation system to, I think, about $3,500. So if that is I don't have the answer. I would assume it's over $1,000 for work, especially since you'd be working with your the foundation of your home, and kind of looking at having somebody come in and kind of analyze the situation.
Gotcha. And we're going to get to Sarah here in once. Sarah, thank you for waiting so patiently. I can't wait to talk about what we're going to talk about with you. But we did have two other questions from our viewers. Mikayla, can you tell us vaping and marijuana smoking, how are those, the risk for lung cancer with those activities compared with like cigarettes? I guess you talked about vaping a little bit before, but so maybe
so that is a really good question. Similarly to vaping and e-cigarettes, the research when it comes to marijuana is not, we don't have as robust of research for that. I will say it is not as carcinogenic as tobacco smoke, but it still contains toxins and carcinogens similar to that smoke. So there is research that does show that it will impact your lungs, really increasing the risk for other respiratory diseases. So we're looking at bronchitis, we're looking at symptoms like a chronic cough, phlegm, wheeziness, really hurting the first line of defense of killing the cells to help remove dust and germs directly from your lungs. So, I mean, anything that you put into your lungs is anything that is not supposed to be in your lungs and is in your lungs is not necessarily, it's not necessarily the best. And even though the research isn't fully there, because there is those toxins and those carcinogens in marijuana and in vaping and e-cigarettes, there is a very likelihood that it would increase the risk of developing lung cancer, increasing lower respiratory infections across the board. So.
Gotcha. One of our viewers just mentioned that $2,000 is maybe the average mitigation cost that's been floated for radon mitigation. Okay, Sarah, thank you for staying with us.
Absolutely.
So the Iowa Environmental Council recently announced a new project with the Harkin Institute, which is, it sounds very exciting. What are you guys going to do?
Yeah, so about a month ago, we announced a project called Understanding Iowa's High Cancer Rates. It's a research and community engagement initiative. So as you had mentioned, Iowa faces a pressing public health challenge as the state with the second highest cancer rates in the country. So the Harkin Institute and Iowa Environmental Council proposed a collaborative initiative that examined potential connections between ag practices and different chemicals that are applied and the cancer incidence across the state. So that combines, it's a two-pronged approach. So combining academic research that will be led by the Harkin Institute and a cohort of external experts, and then a review with community perspectives, public relations, and organizing to inform policy and action. So it's a currently an 18-month project. We anticipate that it will continue past the 18 months. The first 6 months is really focused on the research and the literature review, while we're going out into 15 different Iowa communities that we've selected that have been impacted by cancer through various different reasons. And then after that first 6 months, it will be an external campaign to educate, inform, and then influence policy based on our findings.
And what chemicals or substances are you targeting with this research?
So we're narrowing that down. There's a lot of existing research already out there about different chemicals, but there hasn't really been a comprehensive review of all of the research. And so we want to have a better understanding of some of that research, so we can understand the role that environmental pollution is playing. That's not IEC or the Harkin Institute saying it's one specific chemical, because we know cancer is multifactorial. So we can't ignore pollution as a factor. So our academic cohort or advisory committee, it's led by the provost of Drake, actually, Sue Madison. She is an epidemiologist by training, and they're narrowing it down. So I think it's really important for us to stress that we're not going after any specific ag companies. We're not going after any one specific group. What we're looking at is the chemicals that are applied on golf courses, family homes, large farms, small farms. We're looking at the chemicals, not the people that are applying the chemicals.
And are you looking at sort of the direct contact, the effects of like direct contact with those chemicals, or are you also looking at, say, we put fertilizer on the fields, nitrate leaches from those fields, and can affect drinking water elsewhere? Is nitrate going to be part of it? The farm runoff.
Yes, and Iowa's regulations for chemical applications is one of the most relaxed in the country. And not only do we have regulations that are so relaxed, the monitoring of those regulations is also a challenge too. So looking at, and we don't know the full scope of what this research will look like. I think as we dive into it more, we'll narrow our scope even further. But looking at what time of year do applications occur with agriculture, and is fall application of chemicals needed when ground is frozen? I'm not quite sure what all of that will look like. Our team will dive into that this summer, but it's definitely something that we'll be looking into.
Would you say there's that your research is going to fill sort of an existing void in research about the carcinogens from agriculture in Iowa? Do you think that there's been a decent amount of research out there, or are you guys sort of treading new ground here?
Yes and no. I do think that there's quite a bit of research that's out there on specific chemicals, but looking again at the collective impact of different types of chemicals with other external influences. So cigarettes, exercise, obesity, binge drinking. We realize that it's a multifactorial issue. Looking at the chemicals, we hope to just provide more of a holistic approach or holistic view. What I will say, I think there's a gap in Iowa of who's willing to talk about pollution and chemical pollution. Because Iowa is such an ag-heavy state, Iowa Environmental Council and the Harkin Institute were not anti-ag. I personally have family that has a farm in Manila, Iowa, and grew up going to that farm all the time. So we're not anti-ag. We just want to be responsible with the chemicals and understand the implications of the use of the chemicals. And so we hope our research will create a better understanding of how environmental factors are influencing cancer rates in Iowa. So then we can have a policy discussion about what the solutions are to address these, while we can have a booming ag economy while also protecting Iowans. And it's every Iowan. It's the Iowans that are yet to be born. It's the 60-year-old farmers that are still applying these chemicals. It's the Iowans that have never stepped foot on a farm. Our goal is to protect every single Iowan in every stage of life. And we think that this research is critical. We just need to know how to weave in the environmental factors.
And you just did you just announce this like 2 weeks ago, something like that?
Yes, and the outpouring of support has been tremendous. We're partnering with utilities, we're partnering with water quality experts, with medical professionals. So we're not targeting any one group. I think it's just a group of individuals and professionals that are saying we need to address this, and it's all of our responsibility. And I think what's been the most shocking since we've announced this is the number of Iowans that have reached out to us and told their story of themselves who have been impacted by cancer, or a loved one who have said, I don't have the proof, but I think it's in the water. And I can't confirm or deny that. We're just gathering stories. And I think that's where we hope to find common ground is not everyone might agree on specific policy for water quality or things, but I think we all can agree that rising cancer rates in Iowa is bad and impacts all of us. And we don't want our neighbors or parents or children getting a diagnosis. And so we need to come together to address that.
Well, yeah, agriculture is one of the kings in Iowa. So have you received any blowback from the announcement?
No, we haven't heard anything from any ag companies. I think that's, I've been in my role with IEC for a year now, and one of the things that drew me to IEC was the willingness to talk and work with either side of the aisle or any interest group. IEC is, and the Harkin Institute is willing to work with any ag company, any farmer. We've partnered with Practical Farmers of Iowa and the Iowa Farmers Union. They're both member organizations of IEC, and we've talked with them and gotten their support. But we're willing to meet with anyone, and no group is off the table as far as we're concerned. It's a problem that requires all of us to come together to solve it.
And I know it's still early, but you said you'd identified 15 different communities that you want to, do this research. Have you been able to find people who are willing to do this so far?
Yes. So the goal for each of these 15 listening sessions, and those will happen this summer, and we'll release that in the next few weeks, the date, location of all of these listening sessions. But the goal will first be education. So to have a health professional there to educate on specific types of cancer. Maybe one specific county might have a higher incidence of a specific type of cancer. So looking at here are symptoms, warning signs, what treatment may look like. And then the second portion will just be listening sessions. So a focus group for Iowans to be able to tell their story, for us to collect the data, and really put faces and stories to the issue, as we think that's the best way to influence policy and drive change. It's not the data, it's not the scientific reasoning behind all of it, it's the Iowans that are impacted. And so that's what we hope to be the focal point of our external strategy as we deploy that this next fall.
And so what's going to be the end result of this? Like, what are we going to see, and when are we going to see it, do you think?
I would love to see lower cancer rates in Iowa. I don't think that's going to be a turnkey result of this. I think the most important thing is opening the conversation up. It's not just environmentalists or health professionals, it's everyone that's impacted. So first, being able to open up the conversation. The second will be more understanding of why these cancer rates are increasing in Iowa. And then I hope the third would be policy change. So if we're able to identify specific chemicals or reasons why our cancer rates are increasing specific to environmental pollution, we'll be pushing for changes at the Capitol.
Well, and speaking of potential legislation, there's been efforts in recent years to indemnify Bayer from potential cancers linked to glyphosate or Roundup that it produces. what do you make of that legislation? If it's, if they're successful doing that everywhere, how does that affect people's health in Iowa?
Yeah, the U.S. system for ensuring chemicals are safe really relies on our judicial system as a check. The EPA does not perform their own studies, which I think is a gap. They rely on the studies provided by the manufacturers. And as a result, they set up the parameters for the use and safety of pesticides. So we can start out thinking that a chemical is safe because that's what the manufacturer says, but then later find out that it's not. So what incentive do chemical companies have to do a thorough check on product safety up front if they know that they never have to be held accountable for the illness and disease that might result from their product? There might be a better way to ensure safety up front, but the US system relies on the courts to make sure that we're safe. So we have to preserve the ability to hold corporations accountable. And so that's why IEC has been against the bill. It did not go through this year. I anticipate that it will, that we'll see it again next year, either in Iowa or federally. But at this point, I think that it's our best bet is to continue to protect individuals and have the option to hold those corporations accountable.
Gotcha. We are about 8 minutes away from being done. If anyone in the audience has more questions, please quickly send them our way. We do have one more. Mikayla, if you want to tackle this, the question is, there's apparently, I'm quoting here, stage 1 or 2 research on immune therapy in China. What are they seeing for the effectiveness of that on lung cancer and other cancers, as you know?
I am not 100% positive with my answer here. I believe this is speaking to immune checkpoint inhibitors, which specifically target different proteins in the cancer cells that lead to very targeted treatment. That is what I believe is being referenced here. I will say that biomarker testing in and of itself, which it is not the same as this, but is very similar in the sense of testing your cancer cells for specific biomarkers and proteins in its DNA to be able to to be able to target the cancer a bit more specifically, be able to see what type of cancer it is, does lead to more effectiveness with treatment, better survival rates and outcomes. So I'm not entirely sure. I could see if I could find some more information on that. But yeah, biomarker testing is another thing that has not been is not talked about as much. So if there is a lung cancer diagnosis before any treatment, I would always ask your doctor whether or not you could be tested for biomarkers, because that will allow them and your doctors and physicians and cancer team to be able to say, okay, well, these are the results. It sounds like you have this type of lung cancer. Let's move towards this particular treatment that will specifically target that cancer. And so that happens right after screening, which is one other thing that I do think needs to be mentioned here for lung cancer screening and prevention in particular, that the awareness of lung cancer screening is very, very low, which is why some of these numbers in terms of incidence rates, death rates, survivorship might be lower or might be higher. It's because it's just not well known. It is reimbursable through Medicare and Medicaid. You do need to meet certain criteria to be screened for lung cancer. So you need to be between the ages of 50 and 80, have a smoking history. So 1 pack a day for 20 years, 2 packs a day for 10 years, or have no symptoms or have quit smoking within the last 15 years. So definitely wanted to share that as well as the awareness of lung cancer is so low. The Lung Association does have lung health navigators who can support through the entirety of that process, including after the screening and follow-up and diagnostics. So definitely something to look at when considering prevention and risk assessment for cancer, specifically lung cancer.
Very good, thank you. One more question, if we can tackle it quickly. We could probably spend another 15 minutes on this, but as far as the pollution that comes from, gas-fired, coal-fired power plants, other like large pollutant emitters, are we good at regulating it and monitoring those polluters to protect Iowans' health? This is open to everyone. I think all three of you could probably weigh in on this, perhaps.
I can quickly take this one. There's an article that came out of Reuters recently talking about the Berkshire Hathaway Mid-American coal plants and the impacts. There was a modeling tool that was done by the EPA that showed that pollutions from the plants each year caused up to 7 premature deaths, $104 million in healthcare expenses, and 1,800 lost school days in the metro of specifically Omaha. That's because of the Iowa coal plant with nearly 1 million people. It's been known that this specific coal fleet that includes the coal plants in Iowa is the dirtiest coal fleet in the country, and that impacts asthma rates. Specifically, Sioux City has incredibly high asthma rates, but the particles and the nitrogen oxides that are emitted can be emitted for hundreds of miles and can be impacting local Iowa communities. So I'll drop that link in. But what IEC is now doing with the Clean Up Mid-American campaign to shut down the coal plants, we've deployed some air monitoring sensors up just in Sioux City. We hope to expand that, but we are personally doing air monitoring. The EPA we're in Region 7 in Iowa, and I'm not quite sure with the new administration how much monitoring is going on, but I do know last year they were deploying air monitoring across the region.
Okay, we are down to it. I hope everyone has learned a lot. I have, for instance, my newly minted 15-year-old daughter, I know now that when she comes to me and says, "Dad, I want to vape, smoke cigarettes, or smoke pot, you choose one." I pot, right? Is that what you're saying, Mikayla? I'm kidding. I couldn't do it.
Absolutely not.
None of the above. Gotcha. All right. Thank you all for joining us today. We have discussions going on at noon every day for the rest of the week. Tomorrow's session is focused on pediatric cancer. Thanks again to our presenting sponsor, ITC Midwest, our in-depth week sponsor, Unity Point Health Cedar Rapids. Don't forget to follow Iowa Ideas all year round. Our other in-depth week this year will focus on energy and environment. And our 2-day Iowa Ideas full conference is set for October 2nd and 3rd. Registration is live now, so you can check out, you can register or get more details at iowaideas.com. Thanks again to our panelists and for abiding my tasteless joke there at the end. It was a great conversation, and thanks for being here.
Thanks for having us.
Thank you
So much.